afuera si quieres más fresco.
Hello guys, how are you doing? Can everybody listen?
Yes.
Okay, thank you. We're going to wait a little bit for your classmates to join us, okay? And we're going to start. Hello, guys. How are you doing? First of all, good evening. I see you're not all, well, not all of you joined this meeting. However, I think we waited long enough, so I think we're ready to start. Okay. Before we begin, uh, I'm going to call your names, each one of your names, and please say present or anything to let me know, okay? Is Bianca Elena Barrientos Moran here? Guess she's not. Danitza Diana Burgoa Campos,
Present.
Diana Gabriela González,
I'm here.
Valeria Elizabeth Guerra,
Present.
okay, thank you. Marcela Beatriz Guzmán,
I'm here.
Vania Jalquín Salvatierra, Camila del Carmen Martínez Parada, is Brisa Montoya here?
Present.
Okay, Paola Nicole Pocasangre,
Present.
Mariana Cecilia Sanginés,
Present.
María José Vázquez,
Present.
Constanza Wittmeyer,
I'm here.
okay, Alejandra Guadalupe Saldaña Artiga, Danitza Zambrana Montaño,
Present.
okay, and Diego Bernardo Cuba Salazar.
Present.
Okay, guys, I just wanna take a picture of this and okay, guys, well, now we can begin. Uh, as the coordinator told you, we're going to have the kind of classes that we had yesterday and today, and on Thursdays, we are going to have uh, more practical ones, okay? So we're going to take a look at what we saw yesterday, and I'm supposed to have kind of a conversation practicing what we learned yesterday or what we got to remember, okay? So I'm going to start with the person that yesterday, I don't know if he was busy or anything, but we're going to begin with Bernardo Cuba, okay? Bernardo, are you there?
Yes.
Okay. We're going to practice a little bit of phrasal verbs. Okay. So, did you see the document that I sent to the group?
A little.
Okay, which one did you like or read or remember of the phrasal verbs that are on that document?
Bent over. Uh, I don't understand very well the means of that phrase.
The meaning? Okay, which one? I didn't get to listen. I didn't
Bent
catch it.
over.
Oh, bend over. Okay, to bend over is well, when you have this your patient and you ask him to, well, you know what? Well, tomorrow we're going to have the class about parts of the body. However, you know what waist is, right? Waist. Bernardo, do you know the meaning of waist?
Esperar.
Nope, nope. That's weight, right? Wait. What we're talking about here is, yes, that is the correct one. Waist is cadera. Okay. So when you bend over is when you like you fold, you get your upper body. You know what upper body means, right? The superior part of your body, you put it forward, but your limbs, so your legs, stand still. They don't move, but your upper body goes forward. Did you get it? Like, well, I'm to make sure you understand, I'm going to say the word in Spanish, okay? To bend over is to inclinarse, to inclinar, okay? So when you bend over, you incline your body, the upper part of your body forward. Did you get it?
Yes.
Bernardo, did you get it?
Yes.
Okay, so could you give me an example with this phrasal verb, which is very common in consultation? When, I mean, when you have a patient, you make a lot of directions, right? You ask him or ask her a lot of things, to do a lot of things. This one is very important, to bend over. So when you tell me an example or a sentence, imagining you have a patient that you have right now and ask him or to bend over. Imagine I'm your patient and tell me to bend over for a reason, to have a physical examination.
Okay. I feel pain when I bend over.
Okay, great. Where do you feel that kind of pain? We talked about it yesterday. We talked about the difference between ache, pain, and hurt. Can you relate it to one of those? I mean, give it a context. We're all professionals here. We've all had a lot of reading during university. You can give it a context.
Yes, pain is when es un dolor que se siente bien ubicado y más o menos no lo puede
Okay.
soportar.
Okay. Now, you're saying you have this pain, right? That you feel it when you bend over, right? That's what you told me. So now tell me, I have this kind of pain in this part of my body, and when I do when I bend over, I have this pain. Give it a little context. I mean, like you're the patient. Try to tell me when you do what kind of things you have this pain. Of course, in English. Come on, guys, we're in English class.
Mm, When I went, when I bent over, I feel a pain like a stinging in my back.
Okay, that's great. That was better. Okay, thank you, Bernardo. Um, do you have any other phrasal verb we can work with? In this document I sent, there were a lot of them. So pick one.
No, it's okay.
Okay, you're not going to. Um, okay, let me do this. Okay, who's going to be next?
Me, doctor, please.
Okay, go on. Do you have any other phrasal verb we can work with?
Been down.
Okay, could you give me an example?
My patient been down and feel so much pain in her legs.
Okay, that was great. Yeah, that was a good use. Mm, okay, could you give me another example? Another phrasal verb? I mean, phrasal verbs are commonly used, right? Not only in medical practice, they're all over English. Native speakers use them all the time. So when you use this kind of verbs, when you get used to using them, uh, you're going to make yourself more easily understood. Okay. Okay, so give me another phrasal verb.
Let me see. Breakdown.
Which one? Sorry.
Breakdown.
Breakdown. Okay.
Sí. My patient was hurt when he we he eat anything food. Ay, no, me confundí.
Yeah.
Eh,
Well, you mean number
uh,
6, right? A breakdown.
yes.
Okay.
But I'm confused.
Okay. Don't worry. It's okay. You're participating. That's worth it. Okay. To break down is to stop functioning, right?
um,
or digest.
Ajá. Solo 1 minute. I thinking in an example.
Okay. Do you want me to give you an example to have this well understood?
Care for?
Okay, care for. Okay. To treat and to tend. Okay, yeah. That's what when you have a very disabled patient, right? Usually his or her family takes care of this person, right? Like when this patient has a stroke, like you know what a stroke is, right? All of you guys. Does
Maybe
any of you?
an example. My patient is in bed and his wife has to take care for him.
Okay, that was great. Yeah. Yeah, thank you. Thank you so much. As I was saying, yeah, to care for is to take care of someone, right? Like when you have a patient who has had a stroke, for example, this is the most commonly one of the most common diseases, right? You know, do you know what a stroke is, right? Any of you guys? What does stroke mean?
In Spanish, derrame.
Okay, that was great. Yes, it's an ACV, right? That's how we know it. Yes, they have neurological damage, so they cannot take care of themselves, right? They cannot walk in a proper manner. Well, some patients have neurological deterioration. They cannot talk. I mean, there are a lot of neurological compromise, right? So when a patient has this kind of disease, usually the family has to care for the patient, right? Because he or she cannot do a lot of things. I think you get it, right? Okay, thank you for participating. Um, anybody, does anybody want to give another example with another phrasal verb that we have here?
Me. Me.
Okay, Valeria.
I remember don't give up, I think. Or give up, it was it?
Yes, give up. Yeah,
Don't give up on your treatment, you're almost done.
great example. Yes, to give up is to quit, right? To stop doing something. Yes, that was great. Yes. Another example would be patients with some kind of lung disease, right? They do not have to smoke. So usually, well, as a doctor, you should advise them to quit or to give up smoking, right?
Yes.
Okay, that was great. That's a good example. To give up has a lot of meanings, actually, depending on the context. That was one. Yes. Thank you, Valeria. Thanks for participating. Does anybody want to participate?
Yes.
Me.
Okay. Who was that?
Hola.
Yes.
Paola? Okay.
Okay, I have one and it's breakout in. Alan broke out in fever due to wet, and after he felt headache for the dizziness. in Spanish will be Alan estalló en fiebre debido a la lluvia, algo así, y después se sintió dolor de cabeza debido a los mareos.
Great. That was a lot of vocabulary. Yeah, you have a good English level. Let me tell you. Okay, that was a great example. Yes, that was a good use of phrasal verb, which is kind of complex, right? Because depending on the context, it would also have, I guess, 2 or 3 more meanings. The one that you used is great.
Break down to there are
Yeah,
more meanings.
yeah, it has a lot of meanings. Thank you, Paula. That was a great use of phrasal verb. Okay, who will be next?
Me.
Okay, Mariana, you can go ahead.
Okay. I have an example of fatten up that could be my sister has fatten up because of her pregnancy.
Okay, okay. Could you, to all your classmates, could you repeat just the phrasal verb?
Fatten up.
Okay, what would that mean?
It's when you increase weight.
Okay, yes, that would be great. Yeah, that's good use of phrasal verb. Can anybody give me another example, but with a medical, I don't know, any knowledge that you have from reading, or yeah, basically reading with
Me.
any scientific knowledge that you might have, and apply it with phrasal verb?
Me.
Okay, go ahead.
To lay low. The flu usually lays people low for 5 to 10 days. It means when someone is unable to move or leave their bed.
Okay, yeah, like when we, well, as we said, when a person has this kind of diseases that make a person not be able to move, or has to lay down for a long time, right? Okay, anybody else? Could you give me an example with any kind of diseases that you might know or read about or heard about? Which one of you did not participate yet?
Me,
Okay, Danitza, go ahead.
blackout, the first sentence blackout. They black out after the accident.
Okay. Okay, yeah, yeah, that's great.
Thank you. And breathing. Max has a problem. He breathed in swiftly.
I didn't catch the last part. Sorry.
Max has a problem. He
Okay.
breathed in swiftly.
Okay, yeah, to breathe in, right? To inhale, that would mean inhale, right?
Yeah.
Okay. Could you give me an example with a disease that which is widely known, which is asthma? Could you give me an example with asthma and a patient with asthma, and breathe in and breathe out?
Okay. 1 minute, please.
Okay, yeah, sure. So, you know, as well, I told you yesterday that we're not only going to learn English, but also we will remember and some of you will learn some things about medicine, right? So does anybody know what asthma is all about? Meanwhile, we wait for your classmate to think of an example.
Okay. Max, breathe in slowly, and the breathe out is slowly.
Okay, that's great. Thank you, Danitza. That as well. I'm sure all of you have heard of asthma, right? Can anybody give me a little explanation of it, about it?
Is a condition which your airways and
Yeah,
the airways narrow and swell and may produce
yeah,
traumatic.
yep. Well, asthma is an inflammatory disease of the lower airways, right? They become inflamed, they swollen up, as we saw yesterday. That was another phrasal verb, right? To swell up. They swell up and they make the airway much more difficult, right? And the air is like trapped uh, in your lungs, and well, the patient obviously cannot breathe properly. Can anybody tell me what I'm trying here to remember this? Charcot cylinders. Does anybody did anybody hear about that? Charcot cylinders. It is related to asthma. Okay. There are three anatomopathological characteristics that asthma has. Okay. One of them is Charcot's cylinders. Okay. Did anybody hear about that? Okay, when when a person has this kind of disease, which is asthma, not only well, there's an inflammatory response, but also the muscle that is surrounding the bronchi, right, constricts, and we have these glands that produce mucus, right? They are overstimulated and they produce mucus. So the mucus stays in the small airways, and when a patient is coughing, which is one of the characteristics, the clinical characteristics of asthma, they tend to eliminate, to cough up. Did you remember this phrasal verb from yesterday, right? To cough up. The patient coughs up and eliminates mucus. And when we see that sputum, right, under the microscope, we see these cylinders that are made of mucus. That is what Charcot cylinders are. They are just mucus. Okay. There are two more anatomopathological characteristics, which I'm going to ask you tomorrow. Okay. So going on with what we're talking about with phrasal verbs, can anybody give me another example?
Can I? Yes.
Marcela?
Yes.
Okay, we're all ears.
Okay.
get over it. After a long time, my brother could finally get over the cancer.
I'm sorry, I don't know if it's just me, but I didn't catch that. There was a lot of interference.
Could you hear me now?
Yeah, no, I think it's better. Yeah.
Okay. I'm gonna use get over.
Okay.
After a long time, my brother finally could get over the cancer.
Okay. Yeah, that is a good example. Yeah, to get over. This verb also has a lot of meanings depending on the context, right? We're saying it in Spanish for all those who didn't catch it. It's to superar, right? To get over something is to superar something. We can apply this verb, this phrasal verb, to any kind of disease. Yeah, there are a few patients that get over cancer, yeah, but you can also get over a situation, right? I was having, for example, I was having a bad time. Um, well, last year I was a resident. Uh, I had COVID twice, but now I get to get over it. Yeah, that would be an example. And well, as you can see, this phrasal verb could mean a lot of things depending on the context. Okay, thank you for sharing, for participating. Can anybody use another phrasal verb here?
I can do it.
Okay, Brisa, we're all yours.
Okay, I will use flare up. My
Okay.
allergies tend to flare up in with the humid weather.
Okay, yeah, yes. We saw that yesterday, right? Yes, that's a good use of that phrasal verb, which means to like become inflamed, right? To have the response of your body after you have an allergic reaction, right? Like when someone is eating like fish or what kind of food are the most commonly associated with flare-ups?
Peanuts.
Yes, peanuts. What else? What kind of food would be associated
Seafood.
with kind of, yes, sorry?
Seafood.
Sorry, didn't catch it.
Seafood.
Yes, seafood. Yes, great.
Fish.
Exactly. Yes, seafood, peanuts. What else?
Eggs, milk too.
Yeah, yes, especially cow's milk, right? They are all associated with um, predisposition to some kinds of diseases, including asthma, right? What else? Actually, when we're talking about milk, cow's milk, we're referring actually to a protein, a specific protein. Does anybody know what protein it is?
Iron.
Sorry?
Iron. Hierro.
From milk, we're talking about protein, a protein that makes the cow's milk like associated with allergies. It is beta lactoglobulin. Okay, that's well, you can write it down, yeah, because it's important. What's the protein of the milk associated with allergies? That is beta lactoglobulin. Okay.
Lactose.
Okay. For example, let's use as your classmate said, lactose. What is why are some people? Why do some people not tolerate this peptide? Well, it's not a peptide. Sorry, it's a carb, right? It has it has two. Well, it's composed of two smaller carbs. What are these carbs? Does anybody know? What is lactose composed
Galactose
of?
and glucose.
Yes, galactose and glucose. And does anybody know what a person who does not tolerate this sugar is all about? We would have to have an enzyme, right? That we do not have to separate the galactose from glucose, right? Could you say it in Spanish? Because I know that you know.
Si no me equivoco, estaba hablando de la insulina, ¿verdad?
No, we're talking about lactose intolerance. Some, a person here just said that lactose is composed that is has two parts, right? Galactose and glucose. And when we drink milk, right, we cannot break that link that galactose and glucose have. That is an enzyme, right? What is that enzyme deficiency that make people lactose intolerant? You can say it in Spanish, guys. I know that you heard of it. In Spanish would be lactasa, right? You would break that link between galactose and glucose. Since we do not have lactase, okay, that is the name of the enzyme.
Can I?
Since we, yeah,
Lo puedo decir en español. Está preguntando por la intolerancia a la lactosa. Sería causada por, si no me equivoco, una mala absorción de lactosa. Y
yeah,
si la persona tiene un problema de la mala absorción de lactosa, su intestino delgado produce concentraciones bajas de lactasa, la enzima que
yeah,
descompone la lactosa.
yes, that would be it. Yeah. Okay, yeah, that was great. And since we do not have this lactase, which is the enzyme, right? We do not have this. It fermentates, right, and produces gas. That's why the bowel is filled with gas. And yeah, could you use any other example of phrasal verb? Anybody here?
And build up.
Okay.
I said my patient, as a result, iron can build up in the blood. En Spanish will be como resultado el hierro se acumuló en la sangre.
Okay, yeah, to accumulate, right? That would mean to build up, yes, to accumulate. Okay, that is a great example. Okay, anybody else? Anybody who didn't participate so far?
Can I? I
Sure.
use fill up. The patient's urinary catheter is fill up of urine.
Urine, right?
Yeah,
Okay, yes. To fill up, like to make something filled with a liquid or something. In this case, urine, right? That's what you meant.
yes.
Okay, yeah, that was great. Uh, okay, I'm not hearing Bernardo here.
Yes, I'm here.
Yeah, but you're not participating. Come on, choose any other phrasal verb and give me an example.
Just a minute, please.
Okay. Well, meanwhile, as you get to choose any of these phrasal verbs, can anybody else give me an example?
I don't know if it's correct, but I'm gonna give you an example with kill over.
Okay.
After the practice, Felix killed over with exhaustion.
Okay. Yeah. To run exhausted, right?
Yeah.
Yeah. Let me tell you that you have a great pronunciation. Okay. Anybody else?
I have a question.
Yeah, sure.
Can you use the phrasal verbs with the ing, like passing out?
Yes, of course. You can use a verb with any time form of any kind of verb. Yes, depending on the context, right? Like, let me give you an example. One of your classmates used mm, give up, right? You must have heard.
Yes.
Okay. As I said, give up has a lot of meanings. Like the first and well, in the context that your classmate used it is to quit, to stop doing something, right? Uh, for example, to give up would also mean to um, stop seeing someone. Okay. For example, there's a famous song actually, I'm giving up on you. You must have heard. Well, at least the lyrics, you must have heard of it, right? I'm giving up on you. Like, estoy renunciando a ti, right?
Yes.
That would be an example of give up with with the ing form, right? The continuous present. Yes, it could also be used with the ing and the past, any time form that you would like to, of course, according to the context. Okay, so the answer is yes.
Okay, thank
Yeah.
you.
Okay, you're welcome. Anybody else has another example or maybe a question before we get to Bernardo here?
I have one. My patient blackout in the emergency room.
Okay, to blackout, yes. What does blackout mean, Bernardo?
Desmayarse.
In English, could you try to explain this phrasal verb in English?
Faint.
To faint, yes, that's as concrete as that, right? Is to faint, to lose consciousness, right? Yes, we're going to talk about fainting a lot more when we get to talk to cardiovascular disease and neurological diseases up ahead in this course, of course. And I think it would be in 2 or 3 weeks, more or less. But yes, Bernardo, that's a good example. Okay, anybody else? Or does anybody have a question? Any question, not just about phrasal verbs, any question about anything that we saw yesterday and today? Pronunciation, the meanings of some things. Tomorrow, we're going to have the class about parts of the body. Okay, so if you take a little look at, I don't know, any kind of information that you might have, I'm going tomorrow after class, of course, I'm going to give you also a document that I would like you to read. Okay, it's about anatomical planes, parts of the body. Of course, we're going to go deeper, and it will be a more specific knowledge for all of us. We're going to, or you are all going to be doctors, right? So we have to have a little, well, not a little, a lot of more knowledge than regular people, right? That people do who are not related to medicine. So we're going to see that tomorrow, and take a look at the phrasal verbs that we have in this document. And of course, tomorrow I'll give you another document for you to read, okay? And of course, not just, we're going to analyze parts of the body that you might not have heard about in English, of course, because in Spanish, I'm sure you study them, right, in anatomy, at least in anatomy, and from then on, you must have heard of a lot of more parts of the body. Tomorrow, we're going to focus on external parts of the body, okay, which is the most simple topic about parts of the body that you might have. And I'll see you guys tomorrow if you do not have any other questions. I
I
hope
have one.
you.
Sorry.
Okay. Yeah, sure. No problem.
Yeah. I remember yesterday you told us there are some phrasal verbs that we have to use it on past. Could you explain it a little bit more, because I didn't understood at all?
I didn't catch it because there's a lot of interference in the middle.
Well, yesterday you told us there are some phrasal verbs that we have to use it on past. So I didn't catch it at all.
Okay, yeah. Okay. Well, the verb time always depends on the context, right? For example, we had this phrasal verb yesterday. There was a syndrome actually that was called in the same way, to be burn out, right? Or maybe wear out. We said that wear, let me spell it out, W-E-A-R, right? Means to wear something, to like your clothes, you wear clothes, right? So we said that a phrasal verb is formed by a verb, which in this case is wear, right? And another word, which is not a verb. In this case, is out, right? To wear out, that is the phrasal verb. However, when we say that, when we want to say that we are, well, to wear out is to be completely exhausted, very tired, okay? To wear out is has that meaning, okay? So when you want to say you are feeling that, you say you are worn out, okay? Why worn? Let me spell it out. W-O-R-N, because worn is the past of wear. When you want to say that you feel tired, you listen to it carefully, because I am saying tired. Did you notice the D at the end? That is also the past, right? You cannot say, I feel tired. I feel tired is the correct way, because you are saying that you feel tired. I mean, when you say you want to explain that you feel something, you have to, well, you have to turn the verb into an adjective. Okay, that's what you want to do. Tire is to, let me say it in Spanish, cansar, cansarse. But when you want to say it, what you want to mean that you feel tired, you put that verb, you turn it into past to explain that you feel that way, okay? I feel tired would be me siento cansado, right? In this case, to wear out, we also turn the verb to its past form. And the past form of wear is to worn. So let me give you an example. I had, last week, I had a 36 hour shift. O sea, es decir, tuve un turno de 36 horas. Entonces me siento exhausto. I had a 36-hour shift. That's why I feel worn out. Okay, you turn the base form of the verb into the past form of the verb. Okay, did I make myself understood?
Yes, thank you so much.
Okay, well, thank you for participating. Okay, any other questions? Okay, guys, since there are no other questions, let me know if you want to explain or anything else. Before you leave, I'm going to give this kind of quiz or something. This is not academical quiz, okay? The coordinator asked me to give you this, okay? It's going to pop up on your screen. You have just to choose the options that, after reading, of course, there will be 3 questions, okay? Just 3 simple questions. You read and you will choose the answer that you might feel more comfortable with, okay? So these 3 questions are going to pop up in your screen. Okay. I guess it, okay, did it show up?
Yes.
Okay, so please answer these questions. And when you're done, let me know, guys. And after that, that would be it.
I'm finished.
Okay.
Me too.
Me too.
Me too.
Me too.
Okay, guys. So see you tomorrow. If there's nothing else to say, have a good night's sleep and we'll talk tomorrow. Okay. By the way, the link that I sent you today is going to be the same link for tomorrow's class. Okay. Okay. Well, take care and I'll see you tomorrow. Bye, guys.
See you.
Bye.
Bye.
See you, bye.
Bye. See you tomorrow.